I've been asked a question about the complications of nipple reconstruction following a skin-sparing mastectomy. And complications can occur. Now, I need to explain how nipple reconstruction after a skin-sparing mastectomy is performed. There are a couple ways of doing this. One is what's called a free graft of tissue, often from the inner groin area up to where the nipple should be in the reconstructed skin-sparing mastectomy site. Or a second way of doing this is taking skin at that area and twisting it up and moving it around and then making it look like a nipple. And you follow that by then tattooing around that, and therefore you have a reconstruction, if you will, of the nipple-areolar complex. Now, any surgical procedure has potential complications associated with it. Complications include bleeding, they include infection, they can include tissue loss. What is tissue loss? Meaning, as an example, if you do a free graft up to this site, the tissue may not have enough blood supply to take, and the tissue may die and slough off. The chance of having these kinds of complications following nipple reconstruction are increased if the patient is a cigarette smoker, as an example. Or another example would be that if the mastectomy site had to have radiation therapy, then the blood supply to that area is compromised, and the little tiny vessels feeding that would be important to keeping this twist of skin or free graft alive. If there is a failure, then what may be required is rotating tissue from the back. That's called a latissimus dorsi flap, to sort of put healthy tissue where we need to reconstruct the nipple. Another possibility is a tram flap from the abdomen up to fill in the area instead of a permanent implant or a tissue expander. Now, clearly, if these complications occur, you need to be working with your breast surgeon. You need to be working with your plastic surgeon. Hopefully, these surgeons would have explained to you what the potential complications are up front. Please know that complications, unfortunately, can occur. But also, please know that there are available solutions. And what you need to do is to surround yourself with a top team of people to make sure you get the correct result. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.